A warm welcome to all the delegates to this pre-conference workshop on infection control. This workshop is an introduction to the vast field of prevention and control of healthcare associated infections. I hope the workshop is fruitful and wish all of you success in this new adventure. This part of the video is on the Central Sterile Supply Department. The Central Sterile Supply Department is the heart of every hospital. Sterilization today is a specialized, managed process and is the essence of infection control. Every hospital should have a separate CSSD with proper planning, design and skilled manpower. The process begins with the delivery of used items to the CSSD from the user area. For example, as is shown in the video, an instrument tray is being delivered through a separate dirty corridor to the CSSD. This is being received appropriately in the department and then the actual processes start. The soiled instruments which are delivered to the sterilization or CSSD department begins with washing. The washing process today is crucial to the process of sterilization because mechanical cleaning of an instrument reduces the bioburden from 10 raised to 5 microorganisms to 10 raised to 2 microorganisms. This highlights why and how this step is critical. This is followed by a process called as ultrasonic cleaning. The particles we are really concerned about is organic matter. The addition of enzymes aids the process of cleaning because the enzymes actually help to degrade the proteinaceous material and thereby dislodge that material, particularly organic matters. The washer disinfector washes. It's a mechanical automatic instrument, again, which is shown in the picture. It helps to disinfect, clean, as well as dry the instruments. With this, the cleaning process of the instrumentation is now completed. Once the cleaning and drying or pre-cleaning, as we refer to it, is completed, this is a mechanical process. The items move for the process of packaging. Today, packaging is a highly complicated process. In the early days, we were only using linen packs. However, please remember that linen allows permeation or movement of microorganisms along the thread, and hence we have moved to better quality packaging material. The first set of pictures shows you the packaging or the preparation of dressing packs for the central line dressings. As you can see, the appropriate required number of items are placed in a pack, and this pack that is being used is actually a non-woven fabric, also referred to as medical grade packaging. The next type of packing that is being shown is the preparation of dressing packs. The third process that is being demonstrated is the packaging of linen or linen packs. As you can see, they are double wrapped in linen followed by medical grade paper. For surgical procedures, the operating room nurse assembles the instruments according to the type of surgery after checking each instrument. These packs are based on lists provided by the surgical team. We then move on to the process of sterilization. By definition, sterilization is the destruction of all microorganisms, including bacterial spores. Sterilization can be achieved either by physical or chemical means. The appropriately packaged material is being taken for loading into a steam sterilizer. Once the loading operation is complete, the sterilization process begins, and depending on the temperature of the sterilization process, the time is also controlled. The minimum standards are a temperature of 121 degrees Celsius and a pressure of 15 pounds per square inch with a sterilization time of 15 to 20 minutes. The sterilization processes also include a drying cycle. The unloading operation is carried out into a sterile area. The sterile area is a clean room with bacterial counts being monitored. The workers who enter this area must take adequate precautions in using masks, caps and clean clothes to prevent contamination of items that are being stored in the sterile area. The bacterial counts should also be frequently monitored in this area. The sterile area is connected by a pass box to the operating room on one side and a pass box on the other side for the other items that are being dispensed to other areas of the hospital. Before an item is being used, one must ensure the integrity of the packaging. Ethylene oxide is the second commonly used method of sterilization. However, the ETO gas is carcinogenic and requires special precautions. The packaging for ETO is different with plastics, and one more crucial step that needs to be borne in mind is aeration of treated items, which is a must to prevent residues of the gas. Quality control parameters for sterilization record information on the cycle and serve as a checklist for the CSSD. Load number, load content, temperature and time exposure record chart, regular physical or chemical testing, regular biological testing. Regular maintenance must be performed and documented. Care of soiled linen coming out of the operating rooms is an important issue that requires consideration. Some basic principles in handling soiled linen consist of: all linen should be handled with minimum agitation to avoid aerosolization of pathogenic microorganisms. Contaminated linen may be a source of infection to patients and staff and should be placed in impervious bags or hampers for transportation. The transported linen should then be disinfected by using hot water and or bleach, using heavy duty gloves, eye protection and masks to protect against splashes. The device that is shown in the film is called a sluicing machine, or it's a heavy duty washer that actually disinfects and sluices the contaminated or soiled linen coming out of the operating rooms. Laundered linen should be autoclaved before being supplied to the operating rooms or theatres and high-risk areas, for example, burns units and transplant units. No linen should leave the hospital premises unless it has been decontaminated. The practice of standard precautions is based on the assumption that every patient or every specimen could be potentially infected with blood-borne pathogens. Hand decontamination and hand washing is the most important measure. Barrier protection consists of the use of shoe covers worn appropriately, caps also worn appropriately covering the hair completely, mask well fitting of an appropriate type, apron, gloves of the appropriate type being worn one after the other. All these procedures are being demonstrated. There is an acute need to strengthen strategies for the prevention and control of healthcare associated infections. The three mantras of infection control are hygiene, cleanliness and sterility. This video addresses two of these issues, namely the Central Sterile Supplies Department and standard precautions.